Okay, so we've completed some work on her back. Now I want to move down to the pelvis and the leg. So I'm just going to be draping her again. So we put the hands back in easily. Release the drape, bring it back up. Make sure that they're nice and tight and secure in there. Now on this particular drape for the leg, how I do it is I just expose the area that we're working on. So I bring the sheet into the center here. I keep the area covered if I'm not working on it. So how I like to do it is I bring this up, this leg up. This hand goes under the knee. See this? Can you see this? So I'm lifting her leg up off the table about a couple centimeters maybe. So I'm holding that with my hand, and then I'm resting her foot on my arm here. So I'm holding across two joints. I'm holding across the knee and the ankle. All right. If you do this range of motion stuff, you always want to hold across two joints. All right. So I come under, I take the sheet, I pull it under, and I place it, come here, I put it right in her hand with the other part of the sheet, and she can hold that if she feels more comfortable that way, or for security purposes, or maybe it's her first massage, and whatever. Just if you sense that they're insecure, or they're feeling insecure, or it's cold, or just for whatever reason, this is a real nice technical drape. When you come up into the pelvis, you can just release it from her hand, bring it up a little bit more tight, and then again, this part of the sheet gets tucked under her abdomen here. So this is tight, and this is tight. She has a hold of this sheet, so she's controlling it. So it gives the client the power. Okay? If you need to, you can drape the underwear up a little bit. Like on this massage, I want to make sure that I go ahead and I get the insertions of Piriformis. So that means I need to hit up along the sacral border. You can see she's got some adhesions and hypertonicities in there. So, if she's comfortable with this, I like to leave it like my drape like this, because it allows me to access the tissue in a full stroke here. And it's real nice this way. It's nice to have these long, full strokes, rather than if the drape is this way, you're not accessing the glutes like you could. You have to stop here at the top of the hammies. So I think it's a little bit better this way. But at your discretion, of course. Again, apply the oil using Effleurage. I start at the calcaneus, and I'm always moving up the body for increased blood flow and circulation and lymphatic drainage. Nice long Effleurage. Again, I'm palpating with my hands. I'm feeling as I'm applying the oil. And this is a fairly normal leg, so there's not too much action happening in here. So I just continue on with my Petrissage, open C, close C, up the hamstrings, all the way up into the adductors, into the hamstrings, linear frictions, a little bit slower on these because you're working deeper. This gluteal fold here, can we get a close up of that? See this line? So I'm coming up to the bottom of her pelvis, and I'm using this line as my exit. Okay, so that's a place that you can come out at right there. You can also come out here at the iliac crest. So those are the places you can come out of that linear friction, here or up here. So what that looks like is this. Cross the floor of the pelvis, up into the gluteals, crossing piriformis, coming off at iliac crest at the head of the femur. All right, so I did that. It's all warmed up, it's lubed. Now I drape her again. It's a subconscious communication. It's subtly letting her know, hey, you're safe. This is a healthy touch situation. Okay, so I do that. I might bring this up. I'll do some Achilles tendon. I'll do some calcaneus work. This is a good place to access the bottom of the foot. You can get a lot of yummy massage here at this position. It's a really good way to get the foot and everything else. This is called stripping. So I'm stripping the Gastocs, the low leg. This is called ringing, where you're ringing the low leg. It's a cousin of stripping. You might go back into some faster action here. After all that's set up and you're done and everything's warmed up, you might come back with a little deeper work using the soft part of your forearm, not the elbow, the soft part of the forearm. You come in and you just drop in nice and soft. Continue on up with the linear friction. There's a lot of movement under my arm right here, so things are moving as I'm working up. And that's the beginning of working with fascial sheath. So we just seamlessly moved right in from Swedish massage into the fascial sheath. It's that easy. Moving on up into the sacral area. You might just work with what you have with the client. You might have to adjust their underwear a little bit. If they're not sure about that, you can just ask them, is it okay to do that? And I have had people complain about me when early on in my career. I didn't even really think about it, but you know, if you're working at a place that's a high volume clientele, like a spa or something like that, you always want to be sensitive of that, because some people, they never had a massage before and they don't know what you're doing. So you might need to explain that. In this case, our client doesn't care. All right, so I've got this whole thing exposed now, this whole backside. So now I'm going to work on integrating the upper part of the body with the lower part. So I'm going to be working up like this. And this is real nice for the energy systems to help them engage. Okay, now I'm going to come back in along the border of this sacrum. I'm going to be using my hands with direct pressure, and on her piriformis is pretty tight. So in this case, I'm going to make sure that her drape is really good. Okay, she's got it in her hand again, and what I'm going to do is I'm going to put her into what's called the hiker position, and this is where you bring the leg out externally to the side. You can use your bolster as a way to support the ankle. And what this does is it opens up the pelvic sacroiliac joint a little bit more, so I can easily get my thumb into the groove that I'm looking for here. Am I on that? She said, So that means yes in Russian. Yeah, so things are moving under my thumb. This has been hypertonic for a long time. means it's been this way for a long time. So it's not going to change easy, you know. So it's a little bit of work. This is the work. All right. So I'm right at the top of the femur head, where the femur fits into the acetabulum. I'm right in there because also the piriformis muscle inserts on there. All right. And it's moving, it's going thump, thump, thump. So just within a matter of like 30 seconds, it's already done, the move. Okay, so in that case, go ahead and bring them back out of the hiker position to neutral. Take the drape out. And now they're back to neutral. They're feeling real good by this point. So here I'm going to just do some slight palpations here. Yeah, and everything is moving really nicely here. One way that you can do that is by jostling the ankle. You can jostle the leg a little bit, and you can see how far up the body is moving. So on her, it's moving pretty far up, but I can see here it stops moving, you know, up in here. So I know in my mind that's something that I want to work on with her over a few sessions. And after this massage, I'm going to explain to her what my plan is and what my assessment is, and we'll come up with a plan and do our best. So those are some of the basic Swedish massage strokes and techniques and modalities that I use in my therapy. I hope that it helps anyone who can hear it, and I appreciate you guys for watching. Thanks a lot. God bless and Godspeed. Oh, I forgot to say.